Gwe, Nindaluizi John R. Sillaboy. Hey there, my name is John R. Sillaboy. I'm from Eskilsonia and Millbrook First Nation. We're here in Kjipuktuk, which is the Mi'kmaq unceded territory of our region. I'm here at the Art Gallery of Nova Scotia with co-lead Margot Latimer on the Chronic Pain Network and Aboriginal Children's Hurt and Healing Initiative. We're here to explore how art is an important medium to understand Indigenous history, histories of trauma, for example, and anything that has to do with our health perspectives. This is a place where we can explore more and learn more about pain through art. One Indigenous artist that you may know of is Kent Monkman, a Cree artist who displayed across Canada shame and prejudice as part of the Canada 150th birthday. One of the pieces called Scream displayed here at the Art Gallery of Nova Scotia. Art is an important medium for Indigenous people to share our history, our perspectives, our knowledge, our wisdom around different things. And in this point, art has been an important medium again to share what Indigenous people understand about pain. And in this project with the Aboriginal Children's Hurt and Healing Initiative and with the partnership with AGNS, we have explored that very nature, and we explored how we can understand what pain is from children's perspectives through art. We'll let Kent explain what Scream is about.
I wanted Canadians to really reflect on what the last 150 years have meant to Indigenous people. I wanted to reflect on residential schools, the impact of residential schools, and the 60 Scoop. And for me, at the core of these two things was the removal of children. So that's what I decided to focus on, was the physical act of the children, that moment when the Mounties and the priests and the nuns would come to the reserve and take the kids away for the residential schools. Residential schools were such a devastating and important part of Indigenous lives, shattered families and disrupted our communities, and it continues to affect our families. So I would want Canadians to really learn more, and once people learn more, they're in a better position to make the right choices.
Understanding that pain can be expressed through art, we engaged the Art Gallery Nova Scotia and Mi'kmaq artist Alan Sillaboy to help us work with Indigenous communities and specifically Indigenous youth to express themselves through the art. So we could use that knowledge to share with health professionals so they could make better choices to improve care.
I am a visual artist, a painter primarily. I'll be conducting workshops that will enable the children to make art. This is one way they feel safe and they feel that they can make themselves heard. I think art is communication. Children will find ways to communicate, and also in the medical profession will have an easier time to identify and communicate with children, and I think that's the goal.
It's so important that people have safe and comfortable places for them to express themselves and their feelings, especially if they're difficult ones or ones that are close to the heart. And sometimes words are not even enough, even if they're missing. So art can be an extremely powerful tool, as we know, to express what we're feeling, to try to understand what we might not know, and to also share with one another. We were thrilled to hear that Alan Sillaboy, who's a Mi'kmaq artist, who's also in our permanent art collection, was involved in this initiative and was going to be giving workshops. We knew that there would be a very safe place for young people to express their experience of pain. And these young artists are giving messages and teaching and giving us knowledge that will help us all.
Now, to put the project in context, we'll take a look back where the project had started in my home community, Eskilsonia First Nation. My name is John R. Sillaboy. I'm from Eskilsonia Mi'kmaq Nation, or First Nation. And this is where the Aboriginal Children's Hurt and Healing Initiative story began with the IWK Health Center and with Dalhousie University as well. They wanted to understand from a cultural perspective and from a Mi'kmaq perspective how it is that we can understand what pain and hurt means.
Within the Mi'kmaq language, there's certain words that exist, but there's certain words that don't exist. For example, using the word pain doesn't exist in the Mi'kmaq language.
We know that health is not just that physical cut that you have, but that whole context of spiritual, physical, and emotional. They're all interconnected, and you can't separate one without the other.
You can understand why there would be a disconnect in the communication that exists between healthcare providers and our Indigenous or Mi'kmaq people.
Interestingly enough, in the conversation sessions, they only talked about physical pain.
I had dental pain or I had a stomach ache. And then Alan had told them or asked them, could we go and sit down and start drawing what this pain looks like to you? And their narratives, along with their art pieces, told a dramatic story about the emotional aspects. There was an overabundance of expressions of emotional pain and mental pain. To them, pain is pain.
I think that Canada and the Western views that we have in this country impact Indigenous youth negatively sometimes regarding mental health issues because of our disconnect to our culture. This research project, how Indigenous youth feel pain and express pain and all that, I think it was very interesting because I never really thought about it before, but when I did think about it, we do have a lot of issues in our Indigenous community talking about pain and hurt and things like that. Not even just physical pain, like the intergenerational trauma and the mental health issues that can come along with that. The question is how do we express it? And it's I don't know how to express it, you know? Or how do you communicate that to your doctor?
One half of this painting, her eye, it has the medicine wheel and a skyline of teepees and trees. And this represents the Aboriginal way of thinking and feeling. She has a tear coming down, which represents the pain that Aboriginal people feel and how they view the world. And on the other side of her face, in her eye, it's a toonie, representing the materialistic ways that the Western world thinks and views the world. On the Indigenous side, they're covering her mouth. So that represents them trying to cover up Indigenous pain and their voices from being heard. On the Western side, they're pinching her to smile, and it just again supports very controlling, materialistic, fake happiness views on the world. And then her hair is going crazy because she's going crazy. She doesn't know how to view the world. Both of these visions, she doesn't know how they can connect to each other and find a happy medium.
Art is an excellent medium to help youth sort of express themselves, but also as a research method to help us collect that information.
Welcome to Deidwada Desne, our Aboriginal Health Access Centre. We provide culturally safe and relevant services for the Indigenous community. In our clinic, we have nurse practitioners and physicians.
So I'm a nurse practitioner in primary health care with Deidwada Desne for almost 6 years now. I'm continuing to learn things every day. I think I learn the most from the patients, and I've always learned more and more about kind of looking at health from a more holistic perspective. I remember my first week and a patient had come in, they were in a bit of crisis and some distress, and they had asked me, do you have something that I can hold? I didn't know what they actually meant, but later that patient actually taught me a bit about, they wanted something to, whether it was some sweetgrass or whether it was to have a smudge or to have something sacred that they felt to hold on to. And so ever since then, I always have sweetgrass, I always have sage.
Being able to provide traditional health services through ceremony and healing also addresses the emotional, mental, spiritual, and physical needs of our people.
I want to welcome you to our traditional healing room. This room is very important to us here at Deidwada Desne because it's really about the traditions of our peoples, and it's a safe space where people can come, they can meet, they can be treated, as well as they can share. We have in this room our medicines and access to a number of different treatments.
It's not just physical pain, and we can't look at it from just a physical pain perspective. We have to make sure that the objectives of children being born today have better outcomes than they did 10 and 15 years ago.
We'd like to help health professionals understand how Indigenous peoples' history has impacted health and health-seeking behavior, and the examples of Kent Monkman's art, the art that the Indigenous youth shared with us, as well as a health center example, is important to consider in creating culturally safe spaces so we can acknowledge Indigenous wellness and health beliefs through emotional, physical, spiritual, and mental health and wellness perspectives.
Wilalieg. We just want to express our gratitude to the Art Gallery of Nova Scotia and to artist Alan Silboy, who collaborated on this project with the Aboriginal Children's Hurt and Healing Initiative.